One of the most common questions I get from back pain patients: do inversion tables work? The answer is sometimes. Let me explain. So what is an inversion table and how does it really work? Well, it's basically just a device that you can strap yourself into. It's straight up and down, and it allows you to lay backwards or eventually lay completely upside down. The theory behind that is it's supposed to help your spine decompress. So the goal of the inversion table is to decompress the spine. Now what I mean by that is, if you look at this model, we're looking at bone, disc, and bone, as you can see there. And what this model is demonstrating is a compression of the disc. So the disc should be nice and thick, but as that disc gets thinner and thinner due to trauma or age, the disc can actually start to protrude out the side. That's called a bulge or a herniation. Now if you look at this side, we don't see any evidence of that because, if I get closer, you can see the nerve there has plenty of room to move around and live. But if we compare that to this side, now you can see that bulge sticking out. Maybe you can see that bulge sticking out right there, and it's pinching the nerve. Now, when you get that nerve irritation, that's a very common source of sciatica, sciatic type pain that goes down your leg, which can be numbness, tingling, burning, shooting, weakness, or if it's in your neck, then you can get the stuff that goes down your arms. But as far as back pain, the whole point of laying on an inversion table is to basically try to take the pressure off the spine, off the disc, off the nerve, so that those symptoms go away. So does an inversion table really work? Well, like I said in the intro, sometimes, maybe, ish. It really just depends on how bad the trauma is to the disc, how much degeneration is going on, how much arthritis is going on. And so does it work? Maybe. Is it going to hurt to try? Possibly not. However, there are some limiting issues to inversion tables, and there's three really big reasons why an inversion table wouldn't work. And the number one is you're limited by the angle that you can tilt back. In the beginning, especially if you're an older patient, you really don't want to tip back too far. So really, depending upon how far you can tip back and the angle at which you can do the inversion is going to limit the success of the treatment. And the number two reason that it may not work is time. You can't lay on an inversion table forever. Actually, you shouldn't lay on it for more than just a few minutes. It's highly recommended if you're new to doing an inversion table, 30 seconds, maybe 1 to 2 minutes at most. And then as you can build up your tolerance, maybe you can get up to 5 minutes. I know I've heard of some patients that say they can do 10 or 15, but it's not really something that you can just lay on and get a lot of benefit for a long period of time. And the third reason that it may not work, and in my opinion, the most important reason that it may not work, is even if you could go a full 90 degrees and your body is upside down, the only thing pulling on you is gravity, which really isn't producing a lot of force in order to decompress the spine. Because remember, what we're trying to do is take the pressure off that disc. In order to do that, there's got to be some kind of decompression of that joint. And again, with gravity, you're very limited to the amount of force that's trying to accomplish that goal. And that's why I offer spinal decompression in my office. Spinal decompression is like an inversion table on steroids. You're just not going to be able to compare just the limited of gravity with the amount of force that a decompression table can use. I mean, we can get up to and over 100 pounds of force pulling on your low back, decompressing your spine. An inversion table just can't compare with that. Now, if you're still interested in trying an inversion table, there are some contraindications that you really need to be aware of. If you have high blood pressure, if you have any type of heart disease, especially if you have a history of stroke, if you have glaucoma or any history of eye disease, or if you're pregnant, you're not going to want to get on an inversion table. Furthermore, if you have any type of inner ear problems or a hernia, those are other reasons that you probably won't want to get on an inversion table. But if you're still interested or you're not sure, I would highly recommend that you seek approval from your physician before you try any type of treatment like this. All right, so again, do inversion tables work? Sometimes, maybe-ish. It really just depends on you, and it depends on if you're going to be able to even do the treatment. However, like I said before, if you are suffering with back pain, if you do have disc issues, and especially if you have any type of symptom going down your leg, then non-surgical spinal decompression is going to be a much better treatment option for you as opposed to the inversion table. If you're interested in learning more about those, check out these two videos, and we'll talk to you again next time.